Thank you, Mr. Speaker. Members, this amendment would keep doctors from violating their Hippocratic oath and the principle to, quote, first do no harm. You may know that doctors take the Hippocratic oath during medical school, and it's a core tenet to the practice of medicine in this state. Doctors have come to me and said that this bill would force them to violate their sacred oath. And I think we can all agree that doctors should not be asked or required to violate their professional ethics. Doctors must weigh the risk that a given course of action will hurt a patient against its potential to improve the patient's condition. This is why we can't just use WebMD when we're sick. Doctors are trained to use their judgment and their expertise to follow their Hippocratic oath. All my amendment says is that this bill cannot violate the sacred oath that doctors swear before the public and before God. Members, I hope we allow our doctors to use their training to keep us healthy.
Mr. Schaefer, for what purpose?
Will the gentleman yield for some questions?
Will the gentleman yield for questions?
I yield.
The gentleman will yield.
Representative Talarico, your amendment requires doctors to follow their Hippocratic oath, which is...
Members, it's very hard for the members on the front mic and back mic to hear each other. Please take your conversations outside the room.
Hippocratic oath calls on physicians to do no harm, correct?
That's right.
And you want physicians to follow the science on this, correct?
On this amendment, I want doctors to follow the oath they swore to God to do no harm to the patients they're supposed to be treating.
And would you agree that if they're following the science, then science is not going to lead them to harm children?
Dr. Oliverson and I just had a conversation from the back mic to the front mic that doctors have to weigh the risks of providing treatment and the risks of not providing treatment. Dr. Oliverson acknowledged those can be difficult decisions. He also acknowledged that there are doctors, especially doctors who are trained professionals in this field, pediatric endocrinologists, who believe that gender-affirming care, in some cases, does more good than harm. And that's what we want doctors to use their professional judgment to make these calls.
Well, you use the phrase gender-affirming care. How many genders are there?
So gender, as you and I both know, is something that the medical profession acknowledges is a spectrum. We both have talked about intersex people, those folks who are born without clear male or female either chromosomes or genitalia. And so how gender is defined can be very difficult, and doctors and medical professionals acknowledge that.
Well, how many sexes are there?
There are, in terms of chromosomes, there are 2 sexes.
Yeah,
intersex, Representative Schaefer.
Intersex is a rare genetic disorder.
Well,
but wouldn't you agree that if
Schaefer,
if a person was born with one leg, we would still say that person, that the normal thing for humans is to have 2 legs, correct?
Well, Representative Schaefer, you said it's rare. It's actually the amount of people in the world who have green eyes is the same as the percentage of people who are intersex. So it's not as rare as maybe folks would like to think. And so,
by analogy, you would say also if a person was born with one arm or one leg, it's still the normal thing for a human being. We say that humans are bipedal, correct?
I would say that person has one leg, and I would acknowledge that disability. The point of this amendment, Representative Schaefer, is that doctors, the folks that we trust to make decisions about a person's health care in consultation with the patient, and if the patient is a minor, with their parent, should be allowed to follow their professional ethics. And in this case, that's the Hippocratic Oath, which, as you've already agreed, the first principle is do no harm. If a doctor evaluating the case, evaluating a patient's needs, evaluating the parent's input, decides that gender-affirming care will do more harm than good, then they would follow their Hippocratic Oath in not providing that care. But if that doctor, in evaluating the specifics of the case, believe that not providing that gender-affirming care would do more harm than good, then that doctor would provide that care. Go ahead.
If a patient came to the doctor and said, I want to change my sex, then the doctor should say, well, you can't change your sex because there are only 2 sexes.
If that patient is experiencing extreme gender dysphoria, which Dr. Oliverson has already acknowledged is a real condition, then that doctor has a an obligation, a moral obligation, according to their Hippocratic oath, to ensure that that patient, whether it's a minor in consultation with their parents, receives the treatment that they need. And Representative Schaefer, the consequences of not providing that treatment can be dire. Dr. Gonzalez earlier, when laying out her amendment, talked about the rates of suicide among minors and adults who are experiencing extreme gender dysphoria.
But that doctor, in order to give proper health care, if a child comes to him or her and says, I want to change my sex, then that doctor should tell that child that you cannot change your sex because there are only two sexes and you cannot change a person's sex, correct?
We've talked about the gender dysphoria is different.
You're using the term gender dysphoria, but would you not agree that a person cannot change their sex?
Representative Schaefer, I'm not making up the term gender dysphoria. It's a real condition, one that Dr. Oliverson has acknowledged, and the consequences of not treating gender dysphoria can be suicide.
Simple question.
And Representative Schaefer.
Simple question. Can a person change their sex?
I'm answering your question. Before this bill was filed, there was plenty of evidence that not treating extreme gender dysphoria can not only lead to suicide, but can lead to psychological and physical harm to a child.
Okay, but
and since this bill is filed, the New England Journal of Medicine released a study of 350 young people with gender dysphoria who were receiving hormonal therapy, and it showed that therapy reduced anxiety and depression among those minors receiving that therapy. I'm asking us to follow that evidence, follow that science, and I'm disturbed that this body is not willing to let doctors make these decisions.
I'm asking a very straightforward question. Can a doctor change a child's sex?
A doctor can treat extreme gender dysphoria.
You're not answering the question. I'm asking you, can a doctor change a child's sex?
The different treatments that a doctor can provide can include hormonal treatment.
But can those hormonal treatments change a child's sex?
The hormonal treatments that are provided by a physician are here to treat extreme gender dysphoria.
I don't understand why you keep avoiding the question.
Because I'm
sex has a very defined definition in science, and so I'm asking you, if we're following the science and we're asking the doctors under your amendment to follow the Hippocratic Oath, can a doctor follow the Hippocratic Oath and tell a child that if I give you something that causes you to be chemically castrated, that you can change your sex?
If a child, in consultation with their parents, with the consent of their parents, meets with a doctor and asks how to treat the gender dysphoria that they are experiencing, a condition that we've all acknowledged is a real condition, that doctor has a moral obligation, according to their Hippocratic Oath.
I will stipulate that there are medical treatments for gender dysphoria.
But
are there treatments that can change a child's sex?
Those treatments that you just acknowledged are banned under this legislation.
No, those are mental health treatments.
You're not allowing doctors to make these decisions.
Those are mental health treatments. So my question for you is straightforward. Can a doctor do anything medically, through counseling, through surgery, through medication to change a child's sex?
A doctor, through treatments that we have discussed, that you just acknowledged, can treat a child's gender dysphoria, which is the condition that we're discussing in this bill.
Can I ask it a different way? Can a person's sex be changed?
A doctor, in consultation with parents, according to the science that we just laid out, is able to treat, proven, not just from what I'm saying, not just from what Dr. Oliverson has said, but according to the experts, including the Academy of Pediatrics, has said that these treatments that we're discussing under this bill can treat that condition, which we've all acknowledged is a real condition. So I guess what
You're not answering the question, but let me ask a different question. So if this biological, if a female comes in, 16, 17 years old, well, let's do it this way. Let's say a male comes in, says that he has gender dysphoria, believes that he is a female. Can that person,
that's gender dysphoria, which we just described.
Could that person get pregnant?
The gender dysphoria that you just described can be treated, and it can be addressed through the either hormonal treatment, whether it's the treatments that have been approved by the American Medical Association the Academy of Pediatrics.
But if that 16-year-old boy tells the doctor, I want to be able to have babies someday, what would the doctor say?
The doctor...
The gentleman's time has expired.
Mr. Speaker,